By far, most of our patients who suffer from dry eye disease usually have some type of evaporative dry eye component, and that's usually because of meibomian gland dysfunction. This is a hot topic right now in many parts around the world because dry eye is becoming more and more frequent, and we need to really tackle this as a profession. So in this video, we're going to break down some of the more popular different dry eye treatments specifically for evaporative dry eye disease and meibomian gland dysfunction, and we're doing that right now. Hey, welcome back. This is Dr. Allen here from Eye Care Insiders, helping you master the art and science of vision care. Now today we're talking about meibomian gland dysfunction and the different treatments to help our patients with evaporative forms of dry eye disease. First of all, this whole list that we're going over is not going to be a complete list. I'm just going to be listing off some of the more common ones that doctors often will be prescribing or recommending to their patients, as well as some of the more advanced treatments that you can often bring into your practice if you're thinking of building out your dry eye specialty. First of all, a major part of treating any anterior surface disease has to be recognizing some forms of blepharitis. I feel that a lot of doctors, including myself, have kind of learned through our schooling and any residencies that a lot of patients have blepharitis, especially as they get older, and we've kind of learned to think of that as normal. But if you've ever seen a young individual, maybe a child or a teenager who's got really healthy skin, they often don't have these higher levels of blepharitis, whether it's anterior or posterior. So think of that as your healthy baseline, and when you start thinking of that, you may start to identify a lot more people with these problems. And of course, the big issue is that if you have posterior blepharitis, the swelling of the eyelid, that can contribute to these malformations of the oils within the meibomian glands themselves, and that's going to eventually lead to cell death of the meibomian glands and poor tear film stability. Now, of course, there's many different treatment options for blepharitis out there. You could prescribe something like lid wipes and lid scrubs. You could use something like Avenova or a hypochlorous acid spray that's out there that they can use to clean their face on a regular basis. You could even consider using topical medications such as an antibiotic steroid medication combo. I usually will prescribe either something like Tobradex, maybe something like Maxitrol if Tobradex is not available, or my personal favorite, if available for our patients and if something like an insurance is able to cover it, something like azithromycin. A topical azisite works excellent because it's easy to prescribe, easy for the patient to follow. They're only using it for a few days, and it also has an extra benefit. Azisite has been shown in studies to be very similar to using low doses of oral doxycycline in changing the consistency of the meibomian gland oils and its secretion. So if you are able to, if you notice a patient with blepharitis, you are going to do them a favor of not just prescribing something like azisite for the blepharitis, but you'll also be secondarily helping their meibomian gland dysfunction. Of note, if you haven't used oral doxycycline for meibomian gland dysfunction, typically that is prescribed not at the 100 milligram dose twice a day, but instead at a lower dose such as 50 milligrams twice a day for somewhere between 30 to up to 90 days I've seen it prescribed. Also, with topical azisite, if you're using it for meibomian gland dysfunction, consider prescribing it for longer, as studies have shown them using this topical azisite for up to 30 days. In addition, since we were talking about medications that can be used for meibomian gland dysfunction, cyclosporin A has also shown in some studies to be beneficial for meibomian gland production. So if you have a patient who is experiencing dry eye symptoms and having some level of meibomian gland dysfunction, maybe a mix of both aqueous deficient and meibomian gland dysfunction, consider maybe cyclosporin A for those patients. Now, outside of prescribing medication, whether it be for blepharitis or for MGD in itself, I know many eye doctors, especially for our patients who are just starting to have these issues with meibomian gland dysfunction, will talk about doing warm compresses or hot compresses to the eyelid. Now, myself personally, I have many patients who are doing warm compresses, and it does help manage their symptoms if they are doing it. I even had a patient decide, hey, they didn't like doing eye drops at all, so he just did warm compresses 4 times a day, and he was able to manage his symptoms. Now, while that's being said, I would ask you guys, the viewers of this video right now, have you actually seen improvement of the meibomian gland secretion and improved T-butt scores? Have you started having real good success with treating with warm compresses? Because myself personally, I've had patients who have slightly better T-butt scores, but they're variable and their symptoms sometimes are a little bit better, not very often. And I've even seen patients who are consistent with doing warm compresses like twice a day, and I believe they're doing them, yet they come in, we do a meibography, and we can still see meibomian gland atrophy, cell death, after about 3 months from their last scan. So while warm compresses are still widely recommended and can help with symptoms and improving the T-butt score, as found in several studies, it's something that I certainly recommend to my patients and talk to them about them. However, it's something I do stress may not be an absolute cure for their meibomian gland dysfunction. Now, with that being said, if you are going to recommend warm compresses to your patients, I do suggest that you don't talk about using a warm washcloth. If you have never used a warm washcloth yourself, I suggest pick one up, heat it up under water, put it to your eyelids. You'll find after 15-20 seconds, it cools off, and then you need to reheat it again, and you do it again and again and again. It becomes pretty messy, it's not convenient, and I'm sure your patients are not going to find it very easy to do. And as we know from different studies, you need to get the meibum to about 40 to 43 degrees Celsius in order to melt that meibum to get the oils to start running. Now, if in your practice you don't already offer some type of warm compress that you can sell directly to your patient to make it more convenient, here are my top 3 picks because they are very convenient, they're reusable, and it's something that you can clean and wash. This first one is probably the most famous. These are the Brooder masks. This is one that I used when I was a student in school, and then we ended up bringing it into our practice so we can offer it to our patients. Usually they retail from around $30. It's pretty easy though. Heat it up in the microwave for 15-30 seconds, and then it holds heat for about 10 to 15 minutes, and overall works pretty well. Plus, again, it's washable and reusable. The next one I would mention would be the Tranquil Eyes from Eye Echo. This one is probably the most well-built one that I've seen. It is a little bit higher pricing point. It comes with 2 different ways that it can work, either with these little gel beads that you can heat up in hot water and then put them into these little kind of little pockets that you can soak with water, and then not only is it giving heat, but it's giving moist heat. And they've done a lot of studies through this company, and is probably the most well-documented improvements in meibomian gland dysfunction by using or treating dry eyes by using a warm compress. So this one you can look a little bit more into. They also have one that you have a little snapper thing that you snap inside and a chemical reaction happens and then it heats up. That makes it really convenient because if you don't have a microwave, if you don't have a way to boil water, you can have those available, especially if you're traveling or something like that. I'm also lazy when I'm going to bed and I want to use warm compress. I don't want to get up and have to go use the microwave. Instead, I just like to have one of those next to me so I can activate it, and there I go. Now, this last one from Tear Restore, this one's a little bit new. This is a special mask that has another one of these snappy gel type of activators where you activate it, you put it on the back of the mask, but the advantage of the Tear Restore, and again, this one's pretty new, and there's some good interesting studies about improving your meibomian gland dysfunction, your tear butt scores by about 30% with their pilot studies. But what's nice is that they do allow your eyes to be open while using this mask, which is extremely convenient because then you don't have to sit for 10-15 minutes with your eyes closed. You can still stay relatively productive if you're at home on a computer, which many of our patients are right now. I think this is just something to think about. The price range is somewhere a bit higher, but again, you can check out their website if you want to learn a little bit more. Plus, if you really want to, you might be able to use this as a Halloween costume or something like that. Now, using heat to treat the meibomian glands is a major subject, and that's why LipiFlow and the iLux have been a huge success. I myself have had LipiFlow and iLux both done, and I find that they are an excellent adjunct to your practice if you're trying to think of ways to grow your dry eye clinic. Now, LipiFlow has been out the longest and is pretty convenient for your practice, at least in terms of how it can be run. It's something that a technician could be trained to set it up and have it run without really too much doctor hands-on time. It pretty much sets it up all itself. You let it go, and then the patient just sits there while it's activating their oil glands and heating up those glands and pumping to secrete those oils out of the glands. Oftentimes, patients can go anywhere from needing 1 to maybe 4 treatments throughout the year. It really is something that you need to gauge based on how severe the patient's symptoms are and how well the treatment works for them. Now compared to LipiFlow, the iLux device, which is very similar, is acquired by the Alcon company. The iLux is a handheld version of basically the same thing. It uses intense light to heat up the oil glands, and then it uses a compression mechanism to secrete the oils out of the glands. The nice thing I like about the iLux is that we are able to offer it at a lower price point than many of the LipiFlows are priced at. Plus, it allows me to use a handheld tool so that whether I'm doing it or my technician's doing it, we can see the results of the oil glands melting the oils and watching those oils erupt from the gland. That way we know if there's a specific area of the eyelid that needs treatment, we can still treat that, maybe even do it 2 or 3 times if we need to. Now, outside of LipiFlow and iLux, there is also using IPL. However, using IPL for the treatment of meibomian gland dysfunction and dry eye is technically still off-label. However, I know many practices who use it do fantastic with it and they have excellent results, but it often does take multiple treatments, usually 1 treatment every month for multiple months. Overall, I think if you are planning to utilize any sort of LipiFlow, iLux, IPL, it is wise for you to consider investing in some form of meibography scan device for your clinic. Our clinic, we use the Oculus 5, but it allows us to capture images of those meibomian glands so we can show the patient and we can explain to them what's going on. It also is a great guide and measurement for us to understand if something like an IPL, an iLux, using LipiFlow is even going to help them really. If they've lost all of their oil glands, then it may not be the most effective treatment for them. They're likely not going to experience a real improvement in their symptoms. And really the last thing we want to do is prescribe a treatment, have the patient spend all this money, go through the treatment, and then be unhappy because they don't notice any change. Now, the last 2 things I wanted to mention is that if you are giving samples of eye drops to your patients with dry eye, specifically any form of evaporative dry eye, low T-BUT score, and you're seeing these meibomian gland issues, recommend something with a lipid profile in it. Those extra lipids in those eye drops are going to help improve the stability of their tear film, and you can help explain to them really what's going on, of why they're having these issues with their dry eyes and why their oil glands are an issue, and it really kind of accentuates the need for further management and treatment. I always feel that if a patient understands more of what's going on, they're going to take more responsibility and action for their own treatment and well-being. And finally, I want to comment on a device that has been successful for me personally, as well as for many of my patients, and that is using the NewLids dry eye device. Now, the NewLids device has been out for several years, but it's something that I recently got maybe about 5 or 6 months ago, and started using it at least once a day for at least about a minute at a time. If you've never seen the NewLids device, it is an oscillating kind of looks like an electronic toothbrush that you can apply to your eyelids, kind of like the BlephX treatment that you could use in the office, but the NewLids device is something that your patient can acquire, either purchasing it online or through your office, and then they can use it at home on a daily basis. I do find that it makes it rather convenient and very easy to use, rather than kind of saying, oh, I need to tear open this eyelid cleanser for my blepharitis, I need to use this every day. We all know adherence or compliance to treatments can be pretty tough for patients, but using the NewLids device, it just seems to fit really well. I'm going to brush my teeth twice a day, but I'm also going to use my NewLids device, which I'm going to use on my eyelids, and it's going to help treat not only my blepharitis, but it's going to help manage my meibomian gland dysfunction. And the way NewLids works is that it is an oscillating silicone tip that you put some type of a cleanser on. They are developing their own special eyelid gel for using the device, but it oscillates back and forth, removing the dead skin cells, the dead oils, as well as activating the oil glands, because our oil glands only really work or secrete when you blink. And this oscillating tip tends to have a type of action where it activates those oil glands. It kind of gently pushes and massages on those glands. And again, myself personally, I've been using it. I've been having less dry eye problems myself, and several of my patients who are using this device are noticing improvement. I even have one patient with really severe meibomian gland issues who finds it's the only way she can get relief, and she uses it almost 3-4 times a day. What's fascinating for me is that the results of her Oculus 5 dry eye evaluation shows improvement over time, as well as me personally observing the secretions of her oil glands are improving as she's using this device. Now from here, I'd love to hear from you guys. What other treatments are you recommending outside of this short list for meibomian gland dysfunctions? Are you recommending more omega-3s? Are you recommending things like warm compresses? Are you using the IPL? Are you using the iLux, the LipiFlow? Let me know. I'd like to hear what you guys are all using. using, what you're having success with. There's a lot of information out there in the research, but I think as a group at whole, by talking about this and kind of learning from each other, that's how we're going to ultimately help our patients the best. Otherwise, thanks again for watching. Hope you enjoyed this video. If so, smash that little up thumb button down below somewhere. Go ahead and hit that for me again. Drop a comment. Thanks so much for watching. Again, this is Dr. Allen, and we'll talk to you next time.